Good morning, everyone. Greetings from Calabash, North Carolina. I am Kevin Doherty, and welcome to my first webinar for 2021. I hope you all are safe during these difficult times. This 30-minute live event is being recorded. The recording will be posted on my KMD Insurance website. If you are attending the live event, please note all attendees are in a listen-only mode. We will have time for questions and answers. If you have a question, use your GoToWebinar control box. You may need to click in the area to expand the question area in order to type. You're also welcome to post any comments or requests for future webinars. I will address the questions and comments in the order received during the question and answer session. If you're viewing the recording of this webinar, you're welcome to email me with any questions or comments. All right, folks, let's get started. We have a lot to go over. So on your screen, you should see a document entitled 2021 Medicare Costs. I have downloaded this document from the Medicare website. If you would like a copy of this document, you're welcome to email me and I will reply with the PDF attachment, or perhaps even easier, you can go to my kmdinsurance.com website. And on the website, scroll down just a little bit. And here there is a link, Medicare Costs 2021. Click on the link and you will see the document. All right, Part A of Medicare provides coverage for inpatient hospitalization, and the costs have increased. I am going to attempt to highlight here. So here are the gaps in coverage, which are increasing, the per benefit period stay deductible, and the co-payments for extended stays in the hospital. Medicare Part A also provides coverage for a stay in a skilled nursing facility. The first 20 days are covered at 100%, provided you've had a prior hospital admittance and you're receiving skilled care. And then the co-payment for days 21 through 100 has increased to $185.50. Please keep in mind, Medicare provides no coverage beyond 100 days, and Medicare will not provide coverage if the stay is considered a long-term care expense. Part B provides coverage for the doctors. Part B, physician services in an office setting, also in a facility, including the hospital. So Part A, hospitalization coverage, does not extend to physician services provided while you are hospitalized. The doctors are always a Part B expense. Part B also covers some preventive care, urgent care, emergency room care, and durable medical equipment. I'm going to scroll down because I want to highlight the Part B deductible for 2021 is $203. Now, if you have Medicare Supplement Plan F in place, all of these gaps are paid by the private insurance company. If you have Medicare Supplement Plan G in place, you are responsible for the Part B deductible, which again is $203. It's a calendar year deductible. It resets each January 1st and typically increases approximately $5. The first time you have a service provided, if you have Plan G, the doctor's office will bill you for the $203. After that, you would not be responsible for any other gaps, provided that your doctor accepts Medicare and the service provided is a Medicare approved service. The premium for Part B has increased to $148.50 per month for this year. If you're receiving Social Security benefits, this premium is automatically debited from your Social Security benefit. If you're not receiving Social Security, you likely are being billed directly, and typically the Social Security Administration bills on a quarterly basis. There's also the opportunity to authorize a monthly electronic funds debit from your checking account for the premium and any adjustment that you're subject to due to your income. So on the screen now is the chart for the income-related monthly adjustment amounts for 2021. For 2021, the government will or has reviewed your 2019 tax return. It's a rolling 2-year look back. So if in 2019 your modified adjusted gross income as a single filer exceeded $88,000 or as a joint filer exceeded $176,000, you will have to pay more than the $148.50 monthly. Now, as an example, let's say that we have a joint filer and the modified adjusted gross income in 2019 was $250,000. Well, that will result in the Medicare beneficiary or beneficiaries, if both spouses are Medicare eligible, paying $297. That's the premium of $148.50 per month and the adjustment of $148.50 per month. If you are subject to a Part B income-related monthly adjustment, and if you have either a Medicare Advantage plan in place with prescription drug coverage or a standalone separate prescription drug plan, you will also be subject to a Part D income-related monthly adjustment amount. So if our couple is in that $250,000 range from 2019, in addition to the premium for the given prescription drug plan, each spouse, assuming eligible for Medicare and with a prescription drug plan, would pay an additional $31.80 per month. All this information should have already been provided to you by the Social Security Administration. What I want you to know is that you may have the opportunity to appeal the adjustment. So if you've experienced a life-changing event, such as retirement or a work reduction, perhaps due to COVID, or divorce, marriage, death of a spouse, any one of these life-changing events, if it results in you having lower income in either 2020 or 2021, would allow you to appeal the adjustment. How do you appeal? Well, not surprisingly, there is a form, and the form is appropriately titled Medicare Income-Related Monthly Adjustment Amount Life-Changing Event. Let's use the example of the spouse, the two spouses with 2019 modified adjusted gross income of $250,000. And let's assume that the earner, the high earner, retired 12/31 of 2020. The key to the process is estimating what the modified adjusted gross income will be for either 2020 or 2021, because neither tax return has been completed at this point. In this example, the couple would be better served using 2021 because there's been the loss of earned income. So if hypothetically the income will reduce from $250,000 to retirement income of $100,000, well, that's an appropriate opportunity to appeal the adjustment. And the person could complete this form. Now, both spouses, if subject to the adjustment, would need to complete this form. And in this example, it would be work stoppage, date of the life-changing event, 12/31/2020. That was the retirement date. Tax year 2021. I know the tax return hasn't been completed. It's an estimate. So we can estimate the adjusted gross income plus any tax-exempt interest. Now, the adjusted gross income plus the tax-exempt interest equals the modified adjusted gross income. In our example, married filing jointly would not need to complete step 3 if we're using 2021, and then the person would complete the form Be careful. You need a good faith estimate. You are signing under the penalty of perjury. So again, the key here is estimating your modified adjusted gross income. You may want to check with your tax professional to get help, but any income which is going to land on the 1040 form in 2019, the adjusted gross income line on the 1040 form was 8D, as in boy, and the tax exempt interest is 2A. So that is a great way for you to save money rather than waiting the 2 years for the rolling 2-year look back to catch up. Now, what if you're in the opposite situation where you are a lower income individual? Some states offer senior prescription drug assistance programs. Maryland is one of the states. Washington, D.C. does not offer an assistance program. Virginia offers an assistance program for drugs, but only for those with HIV. So Maryland does have a senior prescription drug assistance program, and on the screen now is the application. I'm going to scroll down to let you know the qualifications for this program. You need to be a Maryland resident, and you need to prove that Maryland residency for at least 6 months. If you're a one-person household, and if your household income, that's basically total income. If it as a one-person household is $38,640 or less, or as a two-person household, $52,260, you will likely qualify for the program. What benefit do you receive from qualifying for the program? Well, the Senior Prescription Drug Assistance Program will pay a prescription drug plan premium up to $50 per month. Okay, perhaps not life-changing, but it may provide assistance. And perhaps more importantly, a member of the Maryland Senior Prescription Drug Assistance Program obtains one special election period during the year outside of the annual election period, which means if there's a change in medications and the current plan doesn't treat the new medications well, that person can make a change during the year, would not have to wait until the annual election period and make a change effective January 1st of the following year. All right, moving on. With the help of my lovely wife, Liz, we completed over 600 prescription drug plan reviews during the annual election period. One of the more popular plans for this year is the SilverScript SmartRx plan. So I have the report from the Medicare website for this particular plan. The premium for the SilverScript SmartRx plan is $7.30 per month. And the plan has a $445 deductible for medications classified as tier 2 or higher. Other popular plans also have the $445 deductible, but imposed on medications classified as tier 3 or higher. Those plans are the Humana Walmart Value Plan, the WellCare Wellness Plan, the WellCare Value Script. Now, why is that important? Because we've done a review. Together, we decided you were well served making a change. But what if a member of the SilverScript SmartRx plan wants to have the Shingrix vaccine? I realize we're all focused now on the COVID vaccine, but what if the person were taking Shingrix? A typical call I'll receive during the year is, Kevin, I'm not happy with this plan. I went for the shingles vaccine and it's not covered. Well, it is covered. Scrolling down to show the Shingrix vaccine is covered, but it's covered as a tier 3 medication. Therefore, the Shingrix, which is the shingles vaccine, is subject to the $445 deductible, and therefore the Medicare beneficiary with this plan would have to pay the full cost. Using CVS as a preferred pharmacy, unless the deductible were met, the person would pay $160.29. If the deductible had been met, the cost would be reduced to $46. So I don't want you to be surprised when you have issues such as this during the year. Any newly prescribed medication will be bound by the terms and conditions of the given plan. And in this case, full price for the Shingrix. And Shingrix requires 2 shots. So if both shots are administered during the calendar year, both shots would be paid at full price unless the deductible were met based on some other medication. I have a second medication here. It's the prep for a colonoscopy. Just another example, $54.14 using CVS. So full price would need to be paid, but if the deductible were met, it would be reduced to $26.53 per month. All right, you're locked into your prescription drug plan for the remainder of the year, unless you have a special circumstance, such as the Maryland Senior Prescription Drug Assistance Program. You'll have the opportunity to review plans during the fall, and if appropriate, make a change for 2022. All right, so I have a little extra time. I'd like to go over some did you know items. One of the issues forwarded to me via email multiple times this year was the concern about chemotherapy drugs not being covered because of this statement right here. Chemotherapy drugs not covered. Chemo drugs are not covered by the Part D of Medicare. Did you know that chemo drugs are covered under Part B, B as in boy? And if it's covered under Part B, it's advantageous because you'll have lower out-of-pocket costs, particularly if you have Medicare Supplement Plan F or Plan G in place. Did you know that vitamins are not covered by the prescription drug program? I received many emails from folks saying, why didn't you include the vitamins in the review? I put it on the review request form. Well, it's because the vitamins are not covered. And I receive a follow-up, yes, but this is a prescription medication. It's prescription vitamin. Doesn't matter. The prescription drug program does not cover vitamins, and it does not cover does not cover compounded medications, even though compounded medications may also be a prescription. Did you know that Medicare Part B now covers acupuncture, but only for relief of lower back pain? Did you know that diabetic supplies are covered by the Part B of Medicare and your Medicare supplement plan? Many times I'll speak to someone asking about the cost of lancets, meters, strips for diabetes. Again, these are covered, these items are considered durable medical equipment and covered by Part B. And if it's covered by Part B, it will be covered by your Medicare supplement. But the catch is you need a prescription for the diabetic supplies, and you must purchase the items from a Medicare certified or approved vendor. So just don't go into a store to purchase these diabetic supplies. Get the prescription, make sure the vendor you're using or the provider you're using is approved through Medicare. And if you have Plan F, you'd have no out-of-pocket costs for your diabetic supplies. If you have Plan G, once the $203 deductible is met for 2021, you'd have no other costs. And lastly, if you have a health savings account balance, now once you're on Medicare, you're no longer allowed to make contributions to a health savings account. But if you had a health savings account prior to moving on to Medicare and you have a balance remaining in that account, did you know that you could use your account balance to pay for your Part B premium, your Part D prescription drug plan, the co-payments or out-of-pocket costs for your medications? However, you may not use the HSA, health savings account, to pay for Medicare supplements. All right, that concludes my presentation. What I would like to do now is move to the questions and answers. If you have questions, please post it. I want to go full screen here. I think I did it. And now I'm going to the questions. So bear with me. I have to expand the box so I can see the questions. Sometimes I have trouble with this, and it looks like I am having trouble with it again. All right, someone was posting trouble with audio. Hopefully that's been resolved. I would like to say that the webinar will be recorded. So if I went too quickly over an item, or if you had an audio issue, or you were late, it'll be posted probably this afternoon, certainly no later than tomorrow. And Toby, yes, Dylan was for you. Toby likes my classic rock albums. All right. Any other questions? I have no audio. Okay, well, hopefully that's been resolved. Yes. So Nina has written to me, she has audio. Does MAGI, modified adjusted gross income, include Social Security payments? Yes. However, well, candidly, the answer is it depends, Sandy. If your income is less than a given level, then your Social Security would not be considered income. But over given levels, and the levels are low, I was wondering if I can get it very quickly for you. It's pretty low level, but up to 85% of Social Security is considered income. So when you estimate it, your tax professional may be able to help you, but you have to estimate what your Social Security total amount would be for 2021 if you're using 2021 as the appeal, of course, and then up to 85% of that income would be considered taxable. For those who may be interested in the Maryland Senior Prescription Drug Assistance Program, full Social Security is counted because it's total income. Does Delaware offer a senior prescription drug assistance program? I will get back to you on that. I'd have to look it up on the Medicare website for you. Okay, do assets matter for the Maryland Senior Prescription Drug Assistance Program? That is a great question. I should have mentioned that. No, it is an income-only requirement. So you could have assets, you can own your home, you could have retirement accounts, but only to the extent that you're taking distribution from retirement accounts or interest and capital gains from non-qualified accounts, which of course appear on your tax return. So no, you would qualify for it. Now I'm having trouble with, I don't know why I have trouble with this. There's more to this. Looks like someone's writing, someone sold her house to live on the proceeds, so she has some money in the bank. Well, again, money in the bank doesn't matter except to the extent that it's generating interest and therefore on the tax return. Can you go over chemotherapy drug coverage again? Chemotherapy medications are covered by the Part B as in boy, the Part B of Medicare, not the Part D. On the drug plan reports that I forwarded to folks, there is a statement that chemotherapy drugs are not covered, which misled people to think that Medicare wasn't covering chemo drugs. Medicare covers chemo drugs through the Part D. Other medications associated with chemotherapy may be part of Part D, such as nausea medications, pain medications, but chemotherapy is covered by Part B of Medicare. If you'd like more info, you can send me an email and I'll send you the link, or you can go to the Medicare.gov website, and in the search box on the Medicare.gov, not .com, .gov website, click chemo or chemotherapy in the search box, and the information will pop up for you. If one spouse is retired but the other spouse is still working, do both have to fill out SSA? Well, it doesn't matter whether one is working or not. The question is regarding the appeal form. The question is whether both spouses are on Medicare, Part B and or Part D. And if so, yes, both spouses will need to complete the form to win the appeal. Thank you. Thank you. A couple of thank yous. No issue with your audio and your transmission. Thank you. I looked on your website for this presentation. Where will it be posted? It'll be posted on my website under the webinars tab. And shout out to my son, John, who helps me. He's a college student. And when he gets a break, he re-records it for me and then posts it on the website. I expect it'll be on the website this afternoon. If you use a service such as GoodRx, which lowers the out-of-pocket costs for RX, does the out-of-pocket cost apply to the deductible? No, it does not. So I actually planned on talking about that today, but unfortunately it was taking up too much time. With the bowel prep that I put up and the Shingrix vaccine, the cost is basically the same if you were to use GoodRx. There would be a $5 savings with the Shingrix vaccine as a Rockville area person if you were to use Walgreens. So in my opinion, it wouldn't make sense to use GoodRx for Shingrix, because if you choose to save the $5, you're not applying it to the deductible. So it's probably more cost effective to use the insurance to bring down the deductible in case there's another medication which is imposed. Is SSA-44, that's the appeal form, filled out for the calendar year 2020 and income goes further down in 2021? Do you have to fill it out 2 times? All right, the answer is yes. So just if the question is, let's use the example of the person who retired 12/31/2020. So for 2021, the government looked at the 2019 tax return, which had the high income. Person appeals, in the example I had given, likely will win the appeal. But then in 2022, the government's going to use the 2020 tax return. And since the person worked throughout the year, that will result in the assessment of an income-related monthly adjustment as well. And a second appeal would need to be sent in to have the income-related monthly adjustment in the example I used eliminated. Does Medicare cover administration fee for COVID vaccine? To the best of my knowledge, yes. I had that same question someone sent me yesterday, and I didn't find it on the Medicare website, so I don't want to definitively state yes, but I read one of the financial websites, one of the insurance company's websites, and it indicated that yes, that Congress has approved the cost of the vaccine and any administration fees to be paid by insurance. Now, the person has to have insurance, and Medicare, of course, qualifies. If someone has their own supplement outside of Medicare and the AARP and they apply for assistance program, well, I have to answer it this way. You're referring to the prescription drug plan. In order for the Maryland program to help with the cost of a prescription drug plan, the person must have a Part D prescription drug plan in place. Hope that answered it. Do I need to complete form each year, even if my adjusted income remains the same? Well, again, it's a rolling 2-year look back. So if you're in the example of the person who retired 12/31/2020, the catch up would occur in 2023, because the government would then look at the 2021 tax return, and in this example, the person has the lower income. So usually the person would need to fill it out for 2 years. You set up our plan. Would you recommend changes? Well, I can't answer that here. I'd have to review. Does Delaware offer a program? I will get back to you on that. I have WellCare coverage. I have some 3-tier drugs. I find that I'm paying more for drugs with WellCare, considering the deductible WellCare covers. Let me see if I can find who this is. Well, Martha, I don't remember if I completed a drug plan review for you, but at this time, unless you have a special circumstance, you are locked into your current plan and you will not be permitted to make a change until the fall of 2021 for a January 1st, 2022 effective date. All right, so we're at 9:30, folks. So I'm going to answer this one last question. Anyone else who has posted a question, which I didn't answer, I will forward an email to you. Is the AGI and tax-exempt interest for the form included for the couple, not just the individual who has a life-changing event? Well, if you go back to the form, if you go to my website and look at the form, there are 3 ways that you can file your taxes. If you're an individual, if you're married, you can file jointly, or you could be married and filing individually. So that chart indicates what your costs would be, and you would appeal based on that. All right, so I think I caught up. I think we are all set. So thank you, folks. If you would like me to address any other topics in the future, you're welcome to use the GoToWebinar box or send me an email, and I will do my best to provide you with the information. So thank you very much. Have a great day. I appreciate your time. Thank you.